concentration because they're looking there. Now what happens when we create a state of focused concentration, or we call fixation? What happens to the brain activity? Can anyone tell me what happens? Don't yell it out, but if you know what happens, I want you to nod, to raise your hand. If anyone knows what happens to the activity in the brain when we're creating that state of focused concentration, or what we call eye fixation. Yes? That's it, exactly. The activity or the amplitude is decreasing. And that occurs just by creating an object of fixation.
But if you know what
And that's what occurs when we create an object of fixation. Yes. And what's interesting, think about the hypnotist in the, everyone, please pay attention here. Think about the hypnotist like Dr. Braid, who used to use a coin and have you stare at the coin. What was he doing? Creating an object of fixation, concentration. What was occurring? The brainwave activity was dropping. The brainwave frequencies were dropping. So actually science was going on even back then, but now we know it because we utilize neuroscience. Okay, so this is important. And then as a hand comes closer, like when I say when you're watching a movie, you'll focus and concentrate on the movie. Pretty soon you're getting to the point where you're feeling the emotions of the movie. This is what's occurring. We're creating a more acute, fine-tuned state of visual focused concentration, or what we might call visual fixation. And then what we're doing is at that point, we're just jolting, giving a little bit of a physical impression or stimulation, we can call it, to the central nervous system, activating the sympathetic nervous system, jumping it up, and then it dropping down, lower than it was when we started. And to me, this is great. This is neuroscience. What's going on to the physiology in the autonomic nervous system when we give that little bit of a pull on the hand and we say that we go or drop or now or active or receptive or tune in or focus? What's going on to that nervous system? It just amplifies a little bit. So the blood starts to circulate a little quicker, heart beats a little faster, temperature change, just a little bit of a shift, and then it resets itself back down further. So it's really an amazing technique, and it's based on biochemistry also. And so this is fantastic. Okay, place your feet on the floor. Good doctor. Let me teach you the technique. In a moment, I'm going to ask you to hold your hands out just like this. So you see, he didn't do it. You.
Follow instructions.
Yeah. Were you?
I did the trick.
Yeah. No, he knows the instructions, because nothing is a trick. This is science. But yeah, I thought you were gonna not do it. Okay. So in a moment, you'll hold your hands out like this. You'll look right in between your hands. Remember, we're not doing it this way. We're doing it this way. You can do it this way. The reason I move my hands is because I'm tuning myself into it. They're tuning themselves into it. We're creating a movement to create a kind of a stimulation to focus and concentrate. Okay? At the same time, when I'm doing this, I'm not engaging in visual contact. Remember this. This is a subtlety. If you engage in visual contact, you will have that visual contact come back. I'm engaging in the focal point of where I want. First, I'm working with the focus. Yeah. And then when I give a little pull on the hand and I say the word drop or the words tune in, receptive, whatever word we're using is an anchor word, then at that point your eyes closed, hands drop down, body relax. You'll just remain in your chair comfortably. Your body might fall a little forward, but you'll just remain sitting in that chair. But you might notice your body just becomes a little more comfortable and relaxed, okay? This way we ensure no one actually leaves their safety area, the chair. Okay. Any questions? Okay. I'm glad to work with you. Yeah, I love your excitement, enthusiasm. It's fantastic. Place your feet on the floor. Okay, hold your hands out just like this, fingers together. Excellent. I want you to look right here. Just gauge your attention right here. We're going to use this as an object of concentration. So don't look at me. But when I count to 3, I'll repeat it again. Slowly let your hands pull in towards my hand, And just feel that's increasing your concentration. That's physical concentration. Physical concentration is a key aspect of physiological, biological hypnotism also. And when your hands continue to move, you're going to focus more. When I give a little pull on your hand, and I say the word tune in, the two words, your eyes closed, head will drop down, body relax. You'll tune into this wonderful, receptive, enhanced state of focus, relaxation, hypnosis. So nod your head yes.
Yes.
Okay. And I want you to think to yourself, I'm going to enjoy this experience right now. Wait till I count to 3. And now 1, 2, 3. Slowly let your hands come closer, closer, closer. Just repeat the word closer, closer. When I pull on your hand and I say the words tune in, your eyes closed, head will drop down, body relax. Go in hypnosis. Closer, closer, closer. All the way in, all the way in, all the way, all the way, all the way. Tune in. Let your entire body relax. From the top of your head, all the way down to the tips of your toes. Good. And I want you to think with each and every exhale, I'm tuning in to allowing myself to be receptive into hypnosis. Completely, totally receptive into hypnosis. With your eyes closed, when I count to 3 and I say up, you'll let both of your hands go into the air. When I say drop, spontaneous, instantly let them fall down by themselves. And notice each time that you let them fall down by themselves, you're going to enhance your quality of hypnosis receptivity. So when I say that one word, your hands will go into the air. When I say the other word, you'll let your hands drop down instantly. But you'll keep your eyes closed and just enjoy this experience. And now up, both of them going up, hands starting to go up into the air. When I say the word up, the other hand goes up too. Both hands going all the way up. Remember when I say drop, you'll let them both fall down instantly, on down by your side, and now drop. Let them drop. Good. Excellent. Excellent. You fine-tune more of a receptive state right now. Feeling good. When I say up, I want you to do the same thing again. But this time when your hands actually fall down instantly, I just want you to sit back into the chair comfortably. And now let your hands go up into the air, up in the air, up in the air, up in the air, up in the air. And now drop, let them fall. Now sit back into the chair comfortably. Lift up your head with your eyes closed. Lift up your head with your eyes closed. And let your mouth drop open right now. Lower jaw getting more relaxed. Think to yourself, it feels really good to enhance my quality of relaxation by simply opening my mouth, following the instructions, and having a wonderful therapeutic mental and physical massage and relaxation and increased focus and concentration. You're doing perfect. Okay, so when I count up to 5 and I say activate full consciousness, open your eyes, coming back feeling good with that great smile that you always have. That smile is contagious. We love seeing it, that smile. It totally makes us smile and feel good. So when I count up to 5 and I say activate full consciousness, open your eyes, come out of hypnosis. 1, 2, 3, 4, 5. Activate full consciousness now. There's that smile. Really fantastic. A big pause.